Welcome to today's webinar, National Census of Victim Service Providers, Making the Most of Data. My name is Susan Howley, and I am the Program Director for the Center for Victim Research. This webinar and all activities for the Center for Victim Research are supported with funding from the Office for Victims of Crime. The Center for Victim Research is a one-stop resource for victim service providers and researchers to connect and share knowledge to increase access to victim research and data and the utility of research and data collection to crime victim services nationwide. We are so pleased to bring you today's webinar. It's my pleasure to welcome our presenters, Barbara Oderkirk and Heather Warnken. They have both been doing wonderful work to develop the statistical information that victim service providers, funders, policymakers, and researchers need to support our national response to victims of crime. And with that, I'll turn this session over to them.
Thank you so much, Susan. Hi, everyone. This is Barbara Oderkirk. I manage our Victim Services Statistical Research Program in the Victimization Statistics Unit at the Bureau of Justice Statistics. That's a mouthful. I will turn it over to my colleague Heather to introduce herself.
Hello, everyone. This is Heather Warnken. I am currently serving in my 4th year as a visiting fellow at the Department of Justice. I am co-affiliated with the Office for Victims of Crime and Bureau of Justice Statistics in the first ever position designed to support the use, dissemination, and translation of statistical data and social science research for the victim services field. And prior to coming to DOJ, I also served on the Project Input Committee for this work from my previous role as a legal policy associate at the Warren Institute on Law and Social Policy at UC Berkeley School of Law.
And today we are presenting on the newly released National Census of Victim Service Provider data, which we're really excited to be here and talking about. But before we dive in, we just wanted to acknowledge up front that although there's only 2 of us giving this webinar today, the effort to fund and collect and publish these data was the result of many people's time and assistance. We worked with quite a large team of researchers and practitioners, and we received a lot of expert guidance from many individuals and victim service organizations. And of course, victim service providers gave us their time to actually complete the census, which makes this data really useful given the high response rates that we got. So we're so excited about being here, but want everybody to realize that this isn't just us. So we wanted to try out the participation buttons right from the start. And if everybody could just raise their hand, if they've been a part of this effort in any way, raise your hand. So that means even if your organization participated, if you provided feedback at some point. Any hands? Looks like we have a little bit of a new group. And if you could just click yes, if the green button here, if you've been a part of any of the past webinars. Have you listened to any past webinars on the NCVSP data already, or read one of our reports, past reports? Click that green button. Okay, some green buttons here. All right, well, that's really helpful information for us, too, as we dive in, because today we will be focusing this webinar primarily on the background and methodology that's required for really analyzing and interpreting the data. And you might have seen we had included the link to download that data when we had everybody register. And we are hoping that a lot of the background information that we've already had presented to date is, because that's available, we're not going to dive in too deep, but we will give more of an overview now that we see how many people perhaps haven't done that reading. So that's very helpful. Thank you for participating in that. So today we're going to provide a brief methodological overview and discussion of roster development and cleaning. So in other words, where did we come up with this first list of victim service providers? And then we're going to talk about the instrument a little bit and the goals of that instrument and how that then translates into some data limitations and strengths of this first initial effort. And then we'll talk about a few of the key findings that have been released to date and some potential data uses that we have to offer, and we'd love to hear from you about how you might want to use this data. And then where to find additional information. You'll see at the end of the presentation today is a slide with all of that more in-depth background information so that we can focus on some of the interpretation things today.
So I'm going to kick us off by laying a foundation and providing some more context for this work. Why collect data from victim service providers? So efforts and events in recent years have really made clear the importance and urgency of bringing a data-informed approach to victim services. So in 2013, OVC released its Vision 21 report, the first major assessment of the field in over 15 years. This historic report provided an in-depth look into the progress made since the field's early milestones, such as the passage of the Victims of Crime Act, VOCA, in 1984, while also identifying substantial gaps that persist today. Through Vision 21, OVC issued a series of findings and recommendations, and first among those was the recognition of the dearth of research and analysis on critical topics related to victim services, and the need to support the development of a body of evidence-based knowledge to guide this field. So we've long had in the U.S. robust statistical data on various areas of victimization collected directly from crime victims, but not from the diverse entities who serve them. So complementing the data we have from victims, the National Census and Survey are major steps in these efforts to produce the most comprehensive quantitative snapshot of this field to date. And additionally, as many listeners know, the field has been in an unprecedented state of growth and change from a funding and policy perspective. So in 2015, Congress effectively quadrupled the amount of money available for victim services through VOCA, removing a longstanding cap on these funds, bringing the total to $2.36 billion that following year. This monumental increase in the availability of CVS dollars hit $4.4 billion in fiscal year 2018. So it's feared by some in the field, the cap actually saw its first decrease and then fell substantially the following year. So as we'll discuss later when addressing potential uses of these data, this context really amounts to critical opportunities to bring a data-informed approach to victim services policy and planning at the state, national, and local level, especially at a time of fluctuations and fiscal uncertainty, and in moving from anecdote to evidence to ensure a meaningful return on investment of these funds.
So in response to the field's call for research on victim services, the Bureau of Justice Statistics, with funding from the Office for Victims of Crime, developed a new victim services statistical research program. And one goal of this new research program was to develop this statistical foundation that Heather's talking about for collecting data from agencies that serve victims. Past research has often collected information from victims about their access to services, although we do intend to build up some of that research as well through this new research program, but we really know very little about the organizations that actually serve victims. In fact, until this new effort, we didn't even have an estimate of how many victim service providers exist, and let alone information about where they are located, the number of victims they serve, the services that they offer, the types of crime they might focus on. So all those very basic characteristics of the field. And as a result of not having this information, that made it really difficult to conduct research with victim service provider agencies. You know, we can't just go out and do a survey, for example, because we wouldn't know if those selected for the survey would actually represent the full field of providers. So we needed a starting point. And so this led BJS, again, working with a very large team of experts to develop this two-phased collection on victim service providers. So first, we have a census where we can get information about all providers, and then the more detailed follow-up survey with a representative sample of providers. This first NCVSP, or the census part of these collections, was designed to build a roster for the first time, and then census that roster to get information about all of the fields, those basic characteristics we were just talking about, so that then, as a follow-up, the National Survey of Victim Service Providers would be more in-depth, that richer picture of the field. We could really dive in deep into specific types of services that are being provided, and so what kind of victims, who, what populations are the focus, things like that. And so just to note the time frame here we're talking about, the NCVSP was conducted from October of 2016 until July of 2017. And so it ended in 2017. A lot of times we'll refer to this as the 2017 NCVSP. And that timing is important to consider. It's a snapshot during that time of when the funding had just increased. You heard Heather say that funding increased in 2015 for the first time. So we're still seeing each year here quite a big difference in the funding level that's going to the amount of money going to the crime victim field every year. And then the National Survey of Victim Service Providers was conducted just recently in May to November of 2019. So today's talk will focus on the census data because that's what was just released, but we will hopefully be able to talk about the survey data more maybe in early 2021 after we've had time to clean it up and look and see what we got. Heather, do you want to jump in here?
Sure. So really can't underscore enough what a major potential opportunity this first ever census and survey represents for the field, and what the process requires in building this infrastructure from the ground up. So we take for granted, for example, that there's a basic body of statistical information we can turn to try to understand more about the 18,000 law enforcement agencies across the country. Building these sources took time and long-standing effort, and a dynamic partnership between the federal statistical agencies and the field. It requires consistent participation from the entities surveyed, and the result is a greater understanding of a key topic in our criminal justice system and uses for the data that span planning to transparency and more. And that work started in the 80s from square one, just like this. So similarly, moving from anecdote to evidence in victim services requires important building blocks. So it was clear that in order to create the ability to survey and understand this complex and important field, which, as you know, spans the criminal justice, public health, social services, nonprofit realm, and more, the first step required gathering a core body of high-level and basic information from all entities in order to establish and organize a working frame. Now, it also involved getting the users of these data involved at the front end. So I think it's really important for us to also emphasize that this was a field-engaged effort from the very beginning. So one of the points that I share frequently in my work around improving translation and dissemination of data is that this isn't just about making information more accessible to practitioners, policymakers, and others who might actually apply it in the real world through better summarizing of the findings, sharing them in more clear, concise, non-academic language and venues, etc. Those forms of better translation and dissemination are all important, of course, and we certainly need to be doing more of them. But equally important, if not more so, is getting those directly impacted by the data at the design and decision-making table of what information gets collected and why. So we're actually pursuing relevant questions and doing it in a way actually capable of speaking to timely issues and questions in this field. And we really had a golden opportunity here to practice these values from moment one.
Thank you, Heather. So one of the most challenging tasks of this initial NCVSP was to develop that list of potential victim service providers. And we've listed some examples here of federal and national and specific lists by different type or locale where we pulled from. But I think what's really important is that the research team did make a very large effort to canvass for lists across all of these different segments of the field in all 50 states and DC, and at the same time led an outreach campaign. So this outreach campaign was led by NCVSP at the time, and the idea was, you might have remembered seeing flyers and emails and things go out all over the place saying, be counted in our census for the first time. So we often refer to this as our Be Counted campaign. And that gave agencies that weren't on one of these initial lists the opportunity to opt in. So to go through some of these examples here, we had from federal lists, grantees that we knew would be serving victims. So from the Office for Victims of Crime, for example, Office on Violence Against Women. At BJS, we had added questions to some of our ongoing surveys with prosecutors and law enforcement agencies to get information about whether they had dedicated staff or programs within their organizations that were serving victims. And then we had a number of agencies come from the National Center for Victims of Crime Directory. And then we had, again, certain segments of the field or parts of the field that focused on certain populations. And then we had outreach in all the states and talked with experts who had oftentimes a list either at the state level or, again, by a particular segment of the field. And this initial roster, as you might imagine, it included a lot of agencies, and it was really, really quite messy. Maybe we can use our participation button again. For everybody who is here, let's do the raise the hand. If you raise your hand, if you work with a referral list that is updated at least annually. How many of you use a referral list that's rarely updated? I'm seeing lots of hands. So a lot of the contact information that we got from these lists was out of date. So a number of the lists were just not updated very often, or even the ones that were, sometimes we would get updated information from one list, but then that same entity might have been on a different list that had not been updated. So that just led to a very messy list with a lot of duplicate information, outdated information, and we also had captured agencies that were not providing victim services or perhaps had closed down or merged with other agencies and so on. Are there any thoughts here?
Yeah, so this theme of being counted. So it's important to stress that this was very intentionally designed for entities to be able to opt into the survey. So in other words, notwithstanding the extensive canvassing and roster development that Barbara just described, we still allowed for the fact that these efforts may not have captured everyone, especially those who might not have fit within longstanding definitions about what it means to be a victim service provider or have received designated funding, yet are still playing a critical role on the front lines of serving and healing in their communities. So the outreach campaign really has from the beginning sought inclusivity, and that has continued and will continue throughout the life of this work. And then lastly, beginning in January of 2016, this first ever fellowship position that I'm serving in also really positioned us to continue to collaborate across federal agencies and across the federal government in the field that allowed for these conversations and extension of the outreach campaign to continue.
Yeah, Heather makes a great point. We are thinking of this as a long-term effort. I mean, this is the initial, the initial development of this roster, but we've learned so much through developing this roster, and we hope that we continue to learn as we think about the best ways to, gain agency cooperation and input and everything that they can provide to us moving forward in terms of who should be included on this roster. And that gets us into questions about eligibility as well, because it was one thing to make it on our roster in the first place, and then after making it on the roster, to make it into the actual survey or census, they had to have provided victim services in the past 6 months. So that's that first question you see on the screen here, and we defined services to victims as direct assistance, including but not limited to referrals, counseling, notices of court proceedings, legal assistance, shelter, medical response, etc. So you can see here again, as Heather mentioned, we did try to be very inclusive in this initial effort, with the idea being it's easier to remove agencies that might not fit certain criteria, and we can navigate that through the instrument. Then if we miss an agency, then we miss them, from here on out. So really did try to take that inclusive perspective. And then once an agency says yes to this question, they were included in the survey, they completed the survey, we had to still navigate, how do you ask questions of different types of providers that make sense? For example, a law enforcement agency might have a program for victim services, but not all staff in that law enforcement agency are dedicated to providing victim services. And if you're asking questions about staffing counts, for example, we would want to know how many staff are dedicated to victim services, not necessarily the full number of staff in that law enforcement agency. And we'd want it to be comparable to, say, an agency where the entire agency, that's their primary function, is to serve crime victims. So all of the staff in their agency are serving crime victims. So that second question you would see on the screen here was our attempt to, for the first time, try to categorize the field in this way. So there are agencies that are serving victims as their primary function, and then agencies that have much broader missions, but do include some sort of dedicated staff or programs to serve victims.
And so again here, just to emphasize that eligibility was based on how people interpreted these questions. So for example, even if your organization serves multiple types of victims, that might be answered differently by different individuals within the organization. And we recognize that it is not so black and white, and really that's the nature of this work. But at this foundational point, had to define it in a clear way for the purposes of, as Barbara was describing, of categorizing in a way that made these entities comparable. So given that this is the first ever effort, we are learning more and more about how diverse entities answer these questions through the results.
And it's great now, as we do get the survey data, we'll be able to see over time, we'll have some of these questions will be the same, so we can see, do agencies change their response, maybe depending on who we talk to or some other factors. So these are all the very new things that we're just learning. Just a quick note on the unit of analysis. The unit of analysis here was agencies or organizations, not the individual programs within an agency. You might have a domestic violence program, for example, or agency, but there might be 5 or 6 different programs within that agency. We did try to focus at the agency level here, and most often organizations reported at the street level address. There is a variable on the instrument that asks providers to report on what service area or jurisdiction they operated, and so we would just say, if, when you're analyzing the data, that would be something to look at depending on how you're wanting to use the data. And another challenging and I think very interesting also part of this initial effort was trying to get the survey into the hands of the right person within each of these organizations. Now, some organizations are much easier, especially if the entire organization focuses on providing victim services. But then you have other organizations like a university or a hospital where there might be multiple people doing different things for victim services. And so just finding the best person within the agency was something we had a lot of discussion about. And we ended up moving forward with this language you see here, which kind of outlines this survey is best completed by someone with knowledge about available services for victims of crime or abuse, victim service funding, and staffing for victim services within your organization. And so even within programs that the entire agency, like even within agencies where the entire agency focuses on victim services, it's still sometimes difficult to find one person who can answer questions about those different types of things that you might focus on. So this language we did find to be pretty helpful in navigating, getting the instrument to the right person, but I think time will tell in terms of more detailed surveys as to who would be the best person to fill out funding questions, for example, compared to what services you're offering. But we were so high level for this first census that it was filled out by just one person the majority of the time.
And just to emphasize that this is an issue that got extensive attention in the early development, cognitive testing, and other phases of this work. And it was particularly through the extensive involvement and dialogue with practitioners that the complexity and importance of this point of contact issue continued to be refined in consideration of the tremendous diversity of size and structure across the various types of VSPs.
So as I said, our initial roster was about 30,000 entities, and throughout the course of actually fielding the NCVSP, we learned somewhat fairly early on that we had about, we had a lot of duplication. Some of this stemmed from having agencies with slightly different names or maybe different addresses or different suite numbers. So there were a lot of ways that we might have had duplication on the file, but it was so much that we actually closed down data collection for about a month and focused on just outreach to help clean up the roster and identify these duplicate cases. And then we were able to open up the data collection again with a much, I guess, more targeted approach and understanding about how to deal with duplication. So that was one challenge we faced in this initial collection that we've learned a lot about in moving forward. We did find about 37% of the agencies were duplicates. About 16% on our initial roster did not serve crime victims, and then 82% participated among those that did serve victims in some capacity. So then we had a second level of cleaning to get to our final frame number that we will report out on moving forward in terms of data analysis. And about 14% of agencies, they did serve victims of crime, and in many of them in very important ways, but they didn't have any dedicated staff or programs to do so, and so a lot of times had a difficulty reporting out on their victim services aspects. For example, they might not know how many staff are dedicated to serving victims. And then we had a few that were located outside the U.S., so those were also excluded for comparability purposes when we moved forward with analysis. And then of the 12,196 victim service providers that had, again, dedicated staff or programs or were serving victims as their primary function, 79% of those responded through Section H on our instrument, which was the staffing questions. So they pretty much completed the full survey, so we called them respondents and considered them in our response rates. For the remaining 21%, we didn't have a lot of information on them, and we weren't able to confirm even whether they were still providing victim services. But because we were being inclusive and we felt that they probably provided victim services at some point in time, and it was really hard to know if they were still doing so, we didn't want to exclude them from our frame at this point in time. So we left them on the frame. We're considering them to be victim service providers during this one snapshot picture, and we looked up as much information as we could online, and we provided at least type of agency and a couple other variables. We refer to these as skeletal variables, and those skeletal variables are available in the data set as well. I'll talk a little bit more about those later. Again, they remained on our frame and are part of this 12,196 for now.
So in addition to the fact that this was the first ever effort, it's very important to continue to think about why the study was done when analyzing the results. So you can't analyze them in a way that is very precise. So for example, getting a specific count of the number of victims served. The majority of this information is based on estimates, and that was really the point given the study's aims. So here are 4 key considerations to keep in mind with the NCVSP. So first, its ability to define and categorize a complex field spanning venues and disciplines, as we've been talking about. Also, its intentionally broad and inclusive nature in order to lay a foundation for the future of this work. That it yields basic characteristics on the universe of providers across this landscape. And finally, that it was designed to ensure the high response rates that were critical to its success, and that we were thrilled that we actually did secure with this census.
Hello, presenters. I think that we've lost you for a moment.
Oh, I'm sorry. I must have been on mute. Sorry about that. So I'll start again. I was just asking if everybody could take a minute to raise their hand if they have already downloaded the data. And I'm taking a minute just to flip through and see how many people have already raised your hand if you have already downloaded the data. Okay. So some hands. So this is just a quick note about where you can access the files. Everything is available on the ICPSR website. You can see there's tabs for data and documentation. And as part of the documentation, you'll see that there's code books that go through the variables, what each of the variables are, and then a study information code book, which provides much more in-depth details about the methodology and unit of analysis and other things like that. The data files are in multiple different formats, so whichever your agency uses should be available to you. And then when you do download it, you have to input your email and agree to use the data for statistical purposes. These are research data, and that's important here because we do have geography level variables on the file too. So just a quick overview of the NCVSP data file. There are 174 variables, including items directly from the instrument. Those are pretty easy to identify. The variable names align well with the instrument. And then we have our skeleton variables, which are all labeled as SK for non-respondents based on public information searches. So again, these were agencies that did not complete the census. And then there's a set of variables for hot deck imputation, where if respondents did not complete a set of variables, they left something blank, we imputed their responses in those variables. So you can use either the original variables or the imputed variables. And then we have some methodological variables like did the organization respond or not, and what was the mode that they responded, meaning did they respond online or via telephone. And then we have some geography variables, which we'll talk a little bit more about. And again, all of this is available in the code book too. So we're going to get into some specific limitations and strengths of the data next. So we'll start just going over, again, a lot of this is based on, again, thinking about the purpose of this survey and the goals of the instrument. Here, we will not have very specific data. Estimates were acceptable for all counts. There are many yes or no response options rather than detailed response options, and we ask very broad categories of services instead of specific services that were provided. Also, we were unable to provide a lot of the funding data. It turned out much of it was missing. There was a lot of confusion about whether funding was provided by a state or federal entity, so that's something we'll think about more moving forward. And then again, just a note that this is a snapshot from this time frame, and we know that a lot is happening right now in the field, so it's just really starting to create that foundation for us.
So the experience of the funding questions was an important learning opportunity, I think not just for this statistical work, but the field overall. That there is, as Barbara was mentioning, a lack of common language and maybe even for some, even confusion about the ways in which various funding sources work in combination and where they originate. This may have significance not just for allocation, but messaging moving forward. And then additionally, regarding the limitation that this is a snapshot from a moment in time in this work, I think this really demonstrates why it's critical for the federal agencies and the field to continue to invest in it moving forward.
But obviously, we're very excited about these data, and we feel there are a number of strengths. It's really a great starting point for understanding the full field of victim service providers across the diverse types of providers across the nation. So even getting basic information on, what % of providers are government versus nonprofit, and then the types of services provided, even at that high level, is our first glimpse of what this looks like for the full field. The types of crime victims served, numbers of victims served by the majority of agencies, staffing counts, and then some really exciting questions were key concerns about staffing, funding, grant reporting, and technology access. And these are all things that we hope you might be interested in looking at moving forward for in a variety of ways, whether that's benchmarking or whether that's looking at what your local area might feel about staffing or funding, or their concerns, or by types of agencies. So I'll pause there. Heather, do you want to add anything about the excitement about these strengths?
Definitely. So this has really been a theme throughout, but to underscore again that one of the main strengths of these data is really the inclusivity. So for example, compared to the other limited sources of existing data out there, such as the performance measurement data for the VOCA or other funding streams relevant to victim services, the census includes entities spanning all sources of public and private funding, and even those deriving substantial capacity from volunteers, for example. So the NCVSP can be combined and compared to other sources such as the PMT, the performance measurement data, victimization data, and other sources of information at the community, state, and federal level. This will present users with the opportunity for the first time in some cases to have a quantitative basis to analyze key questions about the overlap between capacity and availability of services and how this may compare to the actual need.
So next we wanted to talk through just a couple of the variables on the file that we think will be of most interest to people and giving some of the pros and the cautions in using them, because we do hope that after today's webinar you'll download the data and start to explore it and see how it might be useful for you and your agency or the work or research that you do. So one of those variables is the type. It's called type on the file, the type of agency. And this variable in the instrument, you'll notice, was presented as a hierarchy and respondents were asked to select one. So for example, if you look down how that worked, if you're a tribal organization, tribal was up front so that you would hopefully click tribal, but then you might also be tribal and government. And so there were some questions about being tribal and government, but first you would have to click tribal. So while this was a great way to do it in terms of being able to force everybody into one category that we could then use for analyses, and also it gave us very complete data that allows for examining different types of agencies, the caution there is that people did have to check one, and so we didn't capture any overlap in the types of providers, although we do have follow-up questions. So if you said tribal, then we had follow-up questions to ask if you were government. But if you considered yourself to be two of those specific types, like a hospital-based provider that was providing, you're actually a nonprofit provider, but you're providing services in a hospital, for example, then you can only check one. So did they check hospital or nonprofit? We didn't capture that in this survey.
So this is something that we'll really continue to need to grapple with in future collections, and brings us back to the importance of the point of contact issue we discussed earlier. So as Barbara's been describing, the potential variability of responses based on who's answering the question and how it's interpreted.
So another set of variables that I think people so far have been really excited about are the geography variables. We have on there the city and the state so that you can begin to analyze data within your specific region or area. And we also have longitude and latitude variables. So we just want to acknowledge that we're also very excited about these, and it allows for a lot of subnational analyses and increases, we think, the utility of the data. But we also have to be careful in how we interpret, especially the exact locations, because we do know that a lot of agencies, for example, gave PO boxes or might have given an address for their headquarters office, but that doesn't necessarily mean that all the data comes from that specific area, for example. So there are those limitations here to consider when you're actually analyzing the data. For the most part, the city and state variables seem to be pretty good.
So notwithstanding the important cautions that Barbara mentioned, I want to underscore the opportunity presented by the geography component and why so many of us are very excited about this. That really allows users to analyze, for example, how does the geographic distribution of VSP staff in a state or city compared to crime distributions and other indications of need.
And I just want to, I'm noticing the time, but I just want to see a raise of hands. Who thinks having these geography variables is helpful for the work that they're doing? Okay, great. I am seeing a number of hands. It was something we thought a lot about to include or not include. So it looks like it was a good decision to include those. Another variable to consider, staffing counts are often based on estimates, and I'll be quick here because we have said this a number of times, estimates were accepted, but just a note here that the thinking in the beginning was that we might be able to start looking at part-time and full-time staff and how turnover rates look or growth, but we did not capture agency merges or similar changes within agencies, and because of the estimates, looking at turnover and growth could be quite complicated. So we just urge caution in analyzing those variables in those ways, whereas we do think that they are very useful for talking about the size of agencies, the number of staff serving victims in these broad, kind of overview ways.
Yeah, and definitely at the programmatic level, giving VSPs a basis of comparison to understand questions such as how their staffing decisions fit within the national or regional landscape. So we know that staffing and human resources questions are really particularly timely, especially given the changing funding context that we discussed earlier. And I want to flag that the more detailed survey, the NCVSP, will go even further on this topic. And we know that with the boom in funding-driven hiring increases across the field, and with some portion of those positions in jeopardy due to subsequent decreases, that human resources related information is top of mind and an important addition to the knowledge base. So hopefully we can continue to work together toward using this information to address these key questions, such as whether the VSP community is representative or otherwise culturally attuned to the individuals and communities needing support.
Right, and just knowing these basic counts did allow us to ensure that in the follow-up survey, we included agencies that were smaller in staff size and larger in staff size. So that was a very helpful component of this. Just a basic overview of some of the key findings we've released to date. These are all available publicly in our Victim Services Providers Bulletin that we released in November. And so far, what we're seeing is that the majority of the field, which I don't think is a surprise to anyone, is either nonprofit or governmental. So about 45% of agencies were nonprofit or faith-based, and about 43% were government. So again, here we're talking about victim services programs or staff that are based within government agencies. And then you can see a much smaller portion of the field is based in hospitals, medical or emergency facilities, tribal groups, university or college-based agencies, and informal and for-profit groups were included here as well. And we can start to see where are these agencies located, and there's a couple ways we can look at that. Just looking at the basic location is helpful for understanding, well, where are the majority? If you wanted to reach the majority of victim service providers, where would you have to go? And we found that nearly a quarter of providers were located in the 4 largest states, California, Texas, Florida, and New York. But this picture starts to look different when you look at the rate of victim service providers per residence in those states. And here we see the rate ranged from about 2 victim service providers per 100,000 residents in Florida and New Jersey to almost 15 in Wyoming and DC. DC here is a little bit murky because we do have a number of national level providers there, so that's something we'll have to think more about moving forward. And so we want to take a minute to talk through potential uses of the data. And Heather, you've gotten into some of this already, and we've already talked about some of the excitement of the geography level variables. But these data do allow us to look more at the national and regional research on characteristics of VSPs. So because there is so limited information out there, even these very general snapshot pictures of what the field looks like are still very useful. We can examine characteristics of providers in your region for benchmarking purposes, examine providers who serve victims who experience particular types of crime or particular services of categories. We can examine this in combination with other sources of related data, such as crime data or funding data, if you're trying to look at policy decisions, for example, and so many more. And we thanked everyone who shared some of the ideas that you're already thinking about in terms of using the data.
Yeah, so we have been talking about potential uses throughout, but we really hope that we're delivering the message that the sky's the limit when it comes to exploring the many different ways that these data can be put to work for the different uses that you might have in your programs, in your communities, in your states. And on this note of examining in combination with other sources, as we have addressed, for example, there really has been a push at the federal level to both encourage and support states in more coordinated planning across federal funding streams, such as VOCA, VAWA, PHPSA, and even in states where these dollars may be administered by different agencies or offices. There's also a push to promote stronger partnerships between state statistical analysis centers and administrators in putting existing data to work. And our host for today, the CVR, actually has an amazing program that's been bringing together the statistical analysis centers with administrators in very innovative ways. And another important consideration for thinking about how to make the most of these data is thinking about the changing policy landscape and opportunities to innovate in this field. So I think, as some listeners know, within certain parameters, the states retain wide discretion under VOCA on both the types of services and the providers that they fund, under guidance that changed significantly in 2016. So during the same time frame as the historic funding increases through VOCA, OVC issued a new rule interpreting the allowable uses of these dollars, providing the field with much greater flexibility in a number of key areas. So the rule makes permissive and not mandatory a host of new tools for states in using the funds in areas not considered or invested in previously in many jurisdictions. So this includes, for example, civil legal services, restorative justice, transitional housing, relocation, mental health and substance use treatment tailored to meet the needs of those impacted by violence and trauma. And it also includes investing in multi-system, multidisciplinary, coordinated responses. So Census and the survey will provide a new context for these discussions, including identifying where there are remaining gaps in services across the country and where there may be opportunities to innovate, expand, and in some cases even rethink our approach to service provision to fill these gaps, particularly for those victims and survivors who have long been most harmed yet least helped.
So we'll end with this slide that we mentioned that does have links to a lot of other resources and a lot of the background information we weren't able to share today. And at this point, I would love to take questions. I see there are some questions on the side here, and I'm not sure the best way, Susan, if you wanted to help us out or if we should just go through questions here.
I'm happy to help you out, but we can start with, why don't you start with any questions that you see, and I'll pick up any that you may have missed. And folks, please do and take this opportunity to enter your questions in the chat box while we have these experts here. This is your best opportunity to ask some clarifying questions.
So I do see one question. Does this include non-traditional victim service providers? For example, a hospital social worker program maybe that provides info. Hang on, I'm trying to scroll down. So we definitely do have, as you saw, we do have the hospital-based victim programs. We actually are now working on an effort to even expand our frame in terms of the hospital-based providers. We've been working with the National Center for Health Statistics, and we have some ideas for when we field this survey again, the two-part survey. So again, we'll go back out with the census first, and we're hoping to get even more of the hospital-based programs. What we learned is that it's difficult at the hospital level to necessarily reach all the different programs. So for example, if a hospital has a social worker who is providing referrals often, and they consider that to be a program, but then they also have a domestic violence clinic, and they also have a trafficking program. It was hard to capture all of that in this census. So we're rethinking how we might do that for the future. But in short, yes, all of the programs that were identified as part of that roster development were included. And as long as they answered yes to the question of whether or not they provided victim services in the past 6 months, and if they had dedicated staff and programs, then they would have been included in this questionnaire.
Thank you. And really the intent being the inclusivity of the collection and how the outreach efforts remain ongoing so that especially providers, as we mentioned earlier, who may not have been traditionally considered or defined as victim service providers or funded as victim service providers can still be a part of this effort and be counted and understood among this field who are doing the work on the front lines.
Thanks. And we had a more of a comment than a question come in. Someone would like to eventually see the funding data that was provided. I know you said that it was very murky because a lot of people have trouble knowing whether their funding was state funding or federal funding. I believe a few states combine some funding when they do their grant making. It might still be useful for people to see the funding data that was collected, knowing the limitations. Would that be possible in the future?
I think it would definitely have to be a conversation with our leadership too and what they're comfortable putting out in terms of BJS leadership. Not only were the data that we did get was messy, that was one of the problems, but then we also had the problem of just a large number of missing data points. And so anything we do get, it's unclear how representative it would be. I do think it's a good point, though. I mean, even a little bit of data and perhaps data for certain segments of the field might be better than the other parts of the data. So one of the conversations we have had is in the future, perhaps with a little bit more time to dedicate to this, we could at least map out which ones we know had federal funding from OVC, for example, and then be able to look to see exactly how messy the data are. So yeah, I think ask formally, keep asking, and we'll see where that leads in the future.
Great. I did want folks to know that the slides will be made available when we send out the recording link next week, and that the exit poll is going to pop up, but please don't let that dissuade you from continuing to enter your questions. We got another question. You mentioned XY coordinates. Do they refer to city and state or a lower level of geography?
They refer to the exact address given if that was something that we were able to share. So again, a lot of agencies only gave a PO box, and so at that point it would not be the exact location. But yeah, to the exact location that we could possibly get, that's what we provided the XY coordinates for.
Thank you. One person said that they're pretty new at data analysis, but their agency does have Excel. What format should they download the data in?
I mean, that would definitely be up to what you're comfortable learning. You can download in Excel, and if you're comfortable, manipulating data in Excel, that would be fine. SPSS is very easy usually, so if you have access to that, I think that's what the majority of people download the data in. Yeah, I think it would probably be your agency decision. It is possible to do it in Excel, though.
And here's an excellent idea. I'm not sure what the logistics would be to make it happen, but is there a clearinghouse list of projects that people are currently working on? This person would like to start some analysis but doesn't want to duplicate work. That's a great idea.
It's a great idea. We do know that ICPSR tries to link published research to their website, but I also know it tends to be outdated. So yeah, that is a fantastic idea. We would have to think more about that.
Do you have any preliminary insights with regard to gaps in services that you've seen? Barbara or Heather?
Yeah, I'm trying to think. We haven't, there's no great question on the census that gets in gaps in services. So it's really looking at the census data in combination with other sources of data. And so we have started to look at the data in combination with the UCR rates, for example. I haven't looked at it in terms of funding yet, so I think that would be another really interesting way to look at it. So I don't have anything to share so far, but it is something that we're hoping to continue thinking more about and be able to dig a little bit deeper in. We do have more direct questions on the follow-up survey about gaps in services, and so there we'll be able to answer it even just based on the census and survey data.
Yeah, and that's really important. Again, given the foundational introductory purpose that the census serves in this longer-term effort, the follow-on survey does provide much richer information and more detailed questions about gaps that we're looking forward to analyzing in more depth, especially doing so in conversation with the field.
Great. We're also really excited about some of the things we've heard from people who might analyze the gaps question for their regions, because there is so much subnational data here that it's hard at a national level to put out some of those findings, but at the regional and more local levels, there might be more there to look at.
Exactly, and that's a really important point.
Great. We got a question that I'm just going to read. It says, so if I'm understanding what Heather said, will it be possible to see how organizations spent their funding or resources regardless of the source? In other words, we could analyze how resources were spent to identify gaps in types of victim services provided. Is that something that will come from the census, or is that something that will be better delved into as part of the survey?
So I think going back to what Barbara's been sharing about the funding variables, that's more complicated when looking at in isolation with the census, particularly questions directly related to funding. But yes, the follow-on survey will have more nuance, and given the greater depth that it provides, looking at what organizations actually utilize their capacity on, both the types of services, the priority areas, and what they've identified as the gaps in their community compared to what they are able to provide.
But to be clear, there's no variables linking direct funding, so we're not asking how people are spending their money per se, we're just asking about the different things that they're doing.
Yep.
Great, and I know that there should be some other sources of information for that, particularly as more people are filing detailed reports about the grants that they receive and how they spent that money. So I think over time, that'll be another source of information that can be compared or used with information from things like the census.
Mm-hmm.
Can either of you say more about your thoughts about why there were so many duplications of agencies in the initial outreach list?
Sure, yes, I can speak to that. I've looked quite a bit at these data. So what we ended up finding is when we combined across all these lists, you remember when we were initially gathering lists, we started with all these federal lists, but then we went to every state and any area essentially that had lists that they collected. And so we got tons and tons of duplicate agencies, and a lot of that we were able to weed out because we had up-to-date contact information. So for example, though, if an agency, let's say one agency was called something different from another agency by 2 names. Well, initially, we didn't want to exclude anybody that could have been a different agency. We wanted to make sure we were inclusive as possible. Another thing we saw a lot was the agency might have the same address as another agency, but a different suite number. Well, it turns out a lot of those just changed suite numbers over the course of the time of existence, right? And then we had some other cases where agencies would merge together, and that's how we got duplication. But the vast majority of those duplicate agencies, actually, one more big problem in terms of collecting individual level information for agencies was the way that some organizations are organized. They might have different funding streams for different program types, but all of those programs are part of one agency. So again, that issue I was talking about when we were trying to look at the unit of analysis as the larger agency, you know, a domestic violence shelter might have 3 different funding sources for different programs that they're working on. And those funding sources they might have different grant numbers for those. And so when we got all the grant information from federal agencies, we would have gotten that agency 3 times. And each of those would have had a different program name. So we wouldn't have known until we talked to somebody on the phone that those were 3 programs within the same agency, or if they could have been 3 different programs located within the same building. So for fear of wanting to make sure we included everybody that should be included, we initially went out with that list that needed to be deduplicated by talking to people. It was a challenging problem, though, and understandably so. The field was very frustrated because, some people got 10 invitations to complete our survey. And so until we talked to them, if they didn't respond the first time and we sent a reminder letter, that meant 10 more reminder letters. And so we did realize how much of a burden that was to the field.
Wow, that was
thank you to everyone that was patient.
I see that we're already over time a bit, so I'd like to give each of you an opportunity to add any closing thoughts. Barbara, why don't we start with you?
Sure. I'm really excited to see how many people are attending today, and I hope that this translates into a number of really interesting research projects. I hope we see an increase after today in the number of times that these data have been downloaded. We are a pretty small team. BJS in general is a pretty small agency, and there's just not enough of us to analyze all of this really valuable and important data, and especially hard for us to do it at a regional and local level. So that's what I'm hoping, and that was my motivation for being here today, was to encourage everybody to use and really make use of the data. And if you have questions or concerns or something looks strange, please do reach out. I'm happy to be of assistance.
And Heather?
I realize that there are questions and comments that we haven't been able to get to that have come in the chat box and through the registration. So I want to make sure that people know that we are available to continue this conversation and otherwise address those. And just 2 brief points in conclusion: that we recognize that there are always imperfections and limitations to what the quantitative data alone can speak to. And even with these amazing participation rates that we had through the NCVSP, this is, of course, no exception. But especially when combined with other sources of qualitative data and more, this is really bringing us to an entirely new place in this field that we're very excited about. And lastly, I want to emphasize that you do not need a PhD in statistics to put this information to work for your agency or your community. And as Barbara said, we're here to continue to be a support and thought partner in thinking through how to do that in meaningful ways. So I hope you will be in touch and reach out. Thank you so much for attending.
All right, thank you, everyone. And you will be receiving, as I said, the recording and the slides and contact information. We welcome you to dive into this data. Let's make the most of it. Thank you so much for your attendance today. Goodbye, everyone.